Hello, everybody.
Hey guys, how's it going?
Welcome to our second live and not our last live. We just wanted to welcome you all here. The topic today is going to be periodontal disease, a little bit more of an in-depth lecture on what it is and how we can prevent it, and what are the new kind of things that are out there that help with treating it. And it's just going to be a little bit more in depth. So if you have questions, fantastic, shoot them our way. Make sure you let us know you're listening by commenting, giving us thumbs ups or little wow face emojis, because we're doing such a great job. But before we start, let me just reintroduce myself. I'm Dr. Rebecca Himm, and I am the dentist owner here at Himm Family Dentistry. We've been in practice for more than 50 years as a combined practice. I started with my grandfather, then my father, and now me. And this is my associate.
Dr. TJ Thewes. As Dr. Rebecca mentioned, I'm the associate dentist here. I joined the team about a year ago. I've been practicing for about 10 years now. I'm very excited to be here and be a part of the team.
Yeah. And if you have any questions, just so you know, throughout the topic, we won't be interrupting, so we're going to save those for the questions and answer at the end, but please know that we do appreciate them. So thanks. All right, shall we dive into it?
Let's do it.
All right, let's do it. So I get to start. We're going to talk a little bit about what periodontal disease is. So I want to give you a little bit of a background on what the word means, what we're talking about visually when we say periodontal, and where that is in our mouth and our system, and then what invades it and how it becomes disease. Okay, so what we're going to start with is the actual word periodontal or periodontitis. You may have heard that. It's a Latin derivative, and it means around. Periodontal is the tooth, and itis is inflammation. So ultimately, the disease periodontitis means inflammation around the tooth and its surrounding tissues. So let me talk to you a little bit about the apparatus, the periodontium, if you were. This is our mouth, okay? Can you see that okay, Mindy? Mm-hmm. Okay. So this is our mouth, and this is, well, sort of a section of our mouth. This is our tooth, and this is the periodontium. The periodontium simply consists of 4 parts. We have our bone, our jaws, and this is the part, the bone down here, that the tooth sits in. They're called alveolus, and so that is alveolar bone that the tooth sits in. The tooth itself has 2 parts. It has the upper part, the crown with the enamel, and the lower part, the root, and the root is what sits in that bone socket, helping couch that tooth in there, or protect that tooth in there, are little ligaments. Now, it doesn't really show on here, but they kind of have different cross sections. They sit all along in between this bone and the tooth, and they kind of make it like a little hammock for the tooth, right? It sits, it gets a little motion, it allows it to absorb forces and things like that. Attached to, those ligaments attached to the bone and to the outer surface of the root called the cementum. That's what that is. On top of the bone and covering all of the bone is our gingiva, or our gums, okay? So the gums cover the whole bone and this part of the tooth. This part right here isn't really attached to tooth or bone. It has a little teeny pocket here that we'll talk about in a second, but this we call the free gingiva. And that'll become important in a few minutes when Dr. TJ talks about how we assess and what is periodontitis and how it becomes that. All right, moving on. Sorry, if I'm going a little fast, I apologize. We can rewind at some point and go back over it if we need to. Inside this little pocket here, this sulcus, this little space crevice, there is a fluid, and that fluid contains immune cells, it contains proteins, and it contains antibodies. And it helps keep your tooth and your gums clean and healthy, all right? That's our body's way to help keep that healthy. And inside our mouth in general are bacteria, okay? There's good bacteria always, and there's bad bacteria. So a symbiotic relationship is the bacteria that helps us keep our mouth healthy. And a dysbiotic relationship, which is what I'm going to talk about today, are the bacteria that disrupt our normal mouth health, our normal bio film and our normal bio funky, not the word. Sorry, guys. I just want to say it's our normal biome, okay? All right. So let's just kind of now. So this is healthy, all right? You've got all your parts of your tooth. You've got the normal bacteria. You are keeping it healthy at home, which Dr. TJ again will talk about how to do that. And then we get bacteria, okay? And we get the bad bacteria. And where do we get the bad bacteria? Well, the truth is that we get the bad bacteria as a window when we're young. We get it from our family members, our loved ones, when they feed us, when we share food with them, from our friends as we get older, and relationships that we have, because we share that in, like I said, in our food. It's transmitted or passed through our saliva. And then how our body responds to that bacteria can make or break the health of our teeth and our mouth. So I'm going to give you some really big names now, a little bit. But in the periodontal world, we stage our level of inflammation or infection from that bacteria. So if you're in a green stage, you're healthy. Everything's good. Your bacteria are all in balance. Your body's immune system is taking care of itself. But sometimes we have things in our life that disrupt that. So we could have stress. We could become pregnant as women. We could get a disease, a systemic disease like diabetes that could create a problem for our balance. And when that balance goes awry, then we have some players that, they kind of take over. So green, good, right? Then we start to move into the yellow, orange, and red stages. And those are different stages of gum disease, and they have different bacteria that are players, okay? The ones that are really bad and really important, we're going to call the red bacteria, okay? The red bacteria there are three primary players, and one is called Porphyromonas gingivalis, the other is Treponema denticola, and the other is Tannerella forsythia. And to be honest, I had to relook those up, okay? I mean, I'm not going to lie. Like, we had to know all of these when we were in school and when we were taking tests. But let's face it, how many of you really ask me, what's that PG bacteria? But in any case, they are bad players. And what they do is they invade this space. They invade this space and they trigger an immune response. And those cells that are in there, those immune cells that are in there, send messengers through our body, through our blood, and they create a response that's meant to get the bacteria out. So it creates inflammation. That's what inflammation does. It's our body's way to try to get rid of a problem, right? But these bacteria have developed a mechanism to inhibit our immune system's response in a way that makes it act up even more. So your immune system's like, oh, it's not working. And so now it asks for more of that and more of that. And those bacteria then find a way, because they're tricking our immune system, to go deeper and deeper and deeper and deeper into our system. I think that's where I'm going to leave off for now. I know that we're going to probably hit back on this a little bit, but I'm going to pass it off to Dr. TJ, because he's going to now talk about not just what this bacteria is, but how it gets in there and how to take care of it. And then we're going to come back together and talk a little bit more about what I hinted at, of it being not just in your mouth, but affecting your whole system.
All right, well, as Dr. Beck said, I'm going to start off with telling you guys kind of how this bacteria builds up in the mouth. The number one leading factor is poor oral hygiene at home. I want to be clear, when you come see us, or if you see another dentist, when we talk to you about maybe not brushing great or flossing great, we're not doing this to make you feel bad. We're trying to teach you how to best keep things clean so that you get to see us a little bit less frequently. Kind of goes hand in hand with how well you're cleaning, but throughout the day, eating, drinking, going about your life, you're going to build up plaque throughout the day. Part of the reason why we want you guys brushing twice a day is to remove that film. A lot of times, we get a question a lot. That's not my favorite, but I'm going to answer it. I'm only going to brush once a day. When should I do it? Be clear, we want you brushing twice a day. We want you flossing when you brush. But if you're going to do it once a day, the better time is at night, because you're removing the plaque and the bacteria from the previous day. I know we don't love our breath in the morning, but there's not as much plaque buildup when we haven't been out and about doing anything. Additionally, as Dr. Beck mentioned, we start to get these bacteria very early in life from family, friends, so there can often be a genetic component to periodontal disease. It does not mean if your mom, dad, sister, brother had it, you're going to get it. It just means you have a little bit more likely chance of getting it, and we're probably going to tell you that we want you working a little bit harder to maintain health in the mouth. As far as how to do that, as I mentioned, brushing. Electric toothbrushes do work better than manual toothbrushes. The frequency that those are going to vibrate or rotate at help you break up the plaque, break up the bacteria that may be hiding in the teeth, on the teeth, in between the teeth, or in between the teeth and gums. You can do a good job with a manual brush, so if you find that an electric one's a little bit too tender or causes some sensitivity, you can use a manual one. You're just going to have to work a little bit harder to get in between. We also get asked a lot what type of bristles should be used. It should always be a soft bristle. Number one, those softer bristles are a little bit more flexible, so you're going to be able to get further into the pockets, in between the teeth, to get more bacteria out. But also, the harder a brush gets, you can be causing damage to the gum tissues and irritation that is going to ultimately hinder keeping the mouth healthy. Additionally, that's why we call you guys all the time and wonder when you're going to come see us for an exam. The biggest way to prevent this is to have a regular checkup so that if something's going on, we can catch it right at the start. It's much easier to treat a problem when it's small than when it's gotten big. Additionally, your diet's going to be very important. I eat candy, I have pop. We're not going to tell you guys you can never have it, but it's when to have it, how to have it. Should limit our sugar as much as possible because that's what these bacteria really love. That's what they're going to feed on, and that's going to help them proliferate in the mouth. Foods with vitamin C, antioxidants, high in nutrients are going to help the overall body, help keep the tissues a lot healthier and happier in between when you come see us for your cleanings. The reason we want you guys doing that, and I will put this up in the comments because it may be a little bit small, but this diagram just kind of shows a progression of healthy gums all the way down to severe periodontitis. And you can just see that as plaque or bacteria aren't getting cleared up, they will start to deposit more and more of this hard bacteria. And no matter what you guys are doing at home, once that hard tartar or calculus has gotten on there, you won't be able to get that off unless you come see a dentist or hygienist.
Yes, absolutely. So the interesting thing is we talked a little bit about biofilm and plaque buildup and how to get it off. Do you want to go over what plaque is?
Yes, absolutely.
Sure.
So plaque is everybody's favorite word, amalgam of a couple different amalgamation of bacteria, food debris, dead bacteria, and their toxins that they release.
A little bit of salivary proteins in there. Yeah. And it gets really sticky, and they attract each other, and then they stick to the surface of your tooth in that crevice where I showed you earlier. And that's when Dr. TJ showed you that picture. That's when you're not brushing that off, it gets ultimately it will calcify, and then it becomes a place where more bacteria and more biofilm and more plaque can aggregate and create more problems going deeper and deeper. And that's the bacteria's trick.
And because it kind of ties in with this subject, I know we had a question from a patient about water picks.
Yes.
They work great, but I know they can be very confusing for people. They are a lot simpler than they look. Whether you have a tank that sits on your bathroom counter.
I guess you can do it in your kitchen, I just don't recommend it.
Or one of the handheld ones. What you're going to do is fill the reservoir with room temperature, slightly warm water, just so you don't cause any sort of sensitivity while you're doing it. You just hold the tip at a 90-degree angle to the gum lines and follow right along that gum tissue. You're going to pause for a second in between each tooth just to make sure you let the water do its work, get the bacteria, get any food debris out from in between. And then you just go through the whole mouth like that. Make sure to do both the cheek side and the tongue side of all of the teeth.
Yeah, absolutely. A lot of people choose to buy the shower version because it is a little messy when you're learning. It's got a learning curve. And you do want to make sure if you're using a water flosser that you have it at the proper strength. Because studies of water flossing show that if you're not using it at if you have an 8, like a 10 dial, if you're not using it at 8 or above, it's not doing as effective of a job as it should to really remove everything. So.
And on the handheld or the shower version of it.
But once you get there, make sure as long as you're moving it up, then you're in a good place. If you can only use it at a low, and that's all you've ever been able to use it, then you're going to need to use traditional floss as well.
Yep.
Yep, absolutely. All right. Let's see. So let's talk a little bit now about the research that's been happening in the periodontal world. Some myths that people think about periodontal disease, and also just a little bit about how or why we don't just blanket think that people have to come in every 6 months. Does that sound fair?
Yeah.
Okay. So there's a lot of studies out there that inflammatory process and that inflammation from that bacteria are linked to systemic diseases. And I don't really have the time to go through all the research, and it probably would take me 4 years because, let's face it, periodontists who are dentists who specialize in this disease, they go to school for an extra 3 years past when we go to school, and all they do is work with this disease. So if you want more information, or if you've been a patient of ours or anybody's that's ever been told they have periodontal disease, and you have to see a specialist, please know that they are very good at what they do, and that's why they do it. That being said, we also do treat this regularly and help you maintain it. The one thing you should really know too, this is not a myth, is that periodontal disease is never cured. It's never cured, but it is, you can get to a state of health and maintain it. But like Dr. TJ said, it takes a lot of work. It's more than the average person. You have to be super diligent. There's certain people that have a higher risk. If you have an underlying immunodeficiency, if you take certain medications, and if someone needs to know these, please feel free to call me or ask me or comment. We'll go over those at some point, even if it's just one-on-one with you. If you are pregnant, it makes you a little bit higher risk. And it's one of the biggest risks is if you have diabetes, and that is a, as a systemic disease, it's a control issue, a sugar control issue, and that can just increase inflammation in your entire body generally, but definitely make the bacteria in your mouth extra happy.
And diabetes is actually one of the diseases that's best studied
Yes.
with perio, and that's one where there's a true two-directional relationship. So having poorly controlled periodontitis is going to make it tougher for any patient with diabetes to also maintain a normal, healthy blood sugar, and having an abnormal blood sugar will also make maintaining their perio status a lot tougher.
Yeah. One of the things I heard, Dr. TJ, was that if it doesn't hurt, I shouldn't worry about it.
Yeah, that kind of goes all. I hear a lot that I get a little bit of bleeding when I brush, but that's okay. And that's probably the idea that periodontitis has to hurt, or that a little bit of bleeding is normal, is probably the biggest myth with periodontal disease. You may occasionally get a little bit of bleeding because there's some inflammation, but truthfully, if we have healthy gums, we're not going to see bleeding when we're brushing or we're flossing. No. That means, at least in that area, we have not done a good enough job to help our body maintain a healthy state.
And for Ramonis, he's doing his job.
Always. He doesn't take a day off.
No, he doesn't. Not at all. Yeah, and the fact that it doesn't hurt doesn't really mean anything. The best systemic disease that everyone's aware of that I can kind of correlate with that is if you have blood pressure, you don't feel it until it's extremely high, and it's very dangerous. And it's similar with periodontal disease. That's bacteria. They inhibit your sensations too. Like it can start burying itself deeper and deeper and deeper, and you could be in real danger of losing your teeth if you don't take a look at that or get it treated or prevent it. So please keep that aware. Another thing that you do want to be aware of is a risk factor. I'm sorry, I guess I'm going back to risk factors. Is if you're a smoker.
Yes.
That really creates a nice environment for those bacteria. It decreases your perception of disease too, because you don't bleed as easily. It shrinks your blood vessels. So people don't have some of the signs that you, like that bleeding that you shouldn't have, and you would definitely bring you in. It just kind of goes unnoticed if you're not coming in regularly. And how often should you come in if you have gum disease?
It's going to be a case by case. It's going to depend on the severity. Generally, when you're in that more severe, where the red complex that Dr. Beck talked about, you're going to be probably on a more 3-month recall. If it's a little bit early or getting just into the moderate stage of the disease, we'll probably have you come in on a 4-month recall. Both are going to be more frequent than the traditional cleaning, because once the destruction is done to the bone, unless you've done some surgeries and we've been able to recuperate some of that bone's gone. So there's now more space for bacteria and plaque to hang out in.
Yeah. Were there any advancements that you read about that you think our patients would like to know about?
There are a lot of these surgeries, they're starting to go towards what they call microsurgeries. So they're doing smaller incisions with magnification. Why that's better for you guys is that's a smaller flap, so it's less recovery. There are also a lot of the recent research I've been seeing focused more on a lot of those genetic markers, so that we can so that clinicians are able to personalize treatments for patients, because for one patient, just modifying their hygiene at home might be enough to get them to a healthy state. Another patient may have genetic markers that their inflammation's not going to go down, and we need to help target that part of the inflammatory process for them to truly achieve health.
So they're finding that they can give certain...
Yeah, they can find certain markers in the inflammatory pathways.
Oh, okay. And inhibit them, huh?
Yeah.
That's pretty cool. Yeah. I also did read, there's several places that use laser type therapies to decrease the bacteria amount in your sulcus in that area before, so that it doesn't get as advanced as fast. Yeah. All right. Well, that sounds pretty good. Should we go to the Q&A?
Sure.
All right. We just wanted to say hello, Gary. We saw that you were there. Thank you for joining us. And were there any questions, Mindy?
No.
Okay.
Yeah.
Well, that's great. At this point, there's no questions. So I'm going to let Dr. TJ show you we're going to post it in the comments, but a typical case study of a before and after. The treatment the first stage treatment is a deep cleaning or skilling and root planing. And in all honesty, that is the tried and true gold standard. Ideally, you don't have to even go into surgery like Dr. TJ just mentioned, microsurgery or not. We don't really want you to have to go there. And then we can get you back to a state of health. Okay. So that will be posted in the comments. Some of our diagrams will be posted in the comments, so you can kind of see a difference between a healthy and an unhealthy tooth structure. And is there anything else you wanted to add?
No, I think you summed it up pretty well.
Okay. Well, I do want to thank you for anybody who joined us.
Yes,
please
thank you
feel
very
free
much.
to leave a comment, okay? Because we will go through all the comments afterwards within the next, however long the video is up. We'll go through those comments and check to make sure we answer those questions after the live stream. Before we sign off, we do want to remind you that last time we said we were going to do a drawing for a prize. So we are going to do that drawing now, and whoever the lucky winner is, we will have your prize at the office, and you are free to stop by at any time. And Mindy's shaking it up over here. She's probably just going to throw a name at us. All right, who's she throwing? Christine R. All right, Christine R. You know who you are. We can't exactly say your name on there.
We don't want
Unless
to get in
you
any
out
trouble.
yourself, okay? Our next live stream topic will be emergency dentistry. So what to do in a dental emergency, who to call, where to go, what to have, and we're going to help you build your own emergency dental first aid kit.
Awesome.
Yeah, so we hope you all have a great weekend.
Yep, have a great weekend. Thanks for joining us.
Thank you so much.